Today we are doing PRF for under the eyes, and PRF stands for Platelet-Rich Fibrin. So the platelets are going to recruit her stem cells to come over to wherever we put them, and her stem cells will become brand new tissue. So this is especially good for patients that have dark circles or they don't want to do filler. We can put PRF under the eyes, and it's typically 3 treatments, usually once in 8 weeks. And then we look at it. If you need another treatment, we'll do the next one 8 weeks later, or we might just do it in a year. So I've already done a little lidocaine, and hopefully it's nice and numb right there. Perfect. We're gonna make a little channel. And this is how, like I normally do filler, but instead we're gonna do PRF. So we're gonna go right here, and you can see it just filling up. And our patient's issue is more with the darkness than the hollow. So we're just gonna do a thin film, or thin thread, sorry, in here. And we're gonna go around, and it will swell. That happens with the PRF. And it'll come down in a day or two. And we're gonna go all the way out here. And dark circles happen because this area there is thin. The skin is thin, and you can actually just see the vasculature underneath and the blood underneath, and that's why people get dark circles. So that was one side. So let's go do the other side. Is that okay? Mm-hmm. Well, we're using a cannula, so we're not using any needles. So you can get bruising, but because we're using a cannula, the cannula is going to push aside any vessels that it might run into. Can you feel here?
No.
Okay, good. So it's a lot less likely to get bruised because we're using the cannula. And then I always like to remind people that because we use the cannula, as I glide through your skin, like I'm gliding right now, I think you can feel that gliding. Mm-hmm. I'm irritating a bunch of cells as I glide. And because I irritate the cells, they go into fight or flight mode. Well, they can't go anywhere because they're stuck under the skin. So they fight back by making collagen. So just simply the way in which we inject the PRF or even filler, I'll always use a cannula with filler too, will help you stimulate collagen. You okay? Mm-hmm. And there's just a little ligament there to get past. And you can see how that is. And then that's really it. So she'll be puffy for a couple days or a day or two, and then that'll go away. And she can push on it, you can push on it, it doesn't matter. You can do whatever you want to it, but her stem cells are gonna be recruited to come and make more collagen right here. So that's the whole PRF. I mean, that took us 5 minutes. Took us longer to spin the blood than it did to do the procedure. And really no other risk factors. I mean, she could go to work, nobody would know. And it's your own blood, so there's no risk with that either. So if you want to learn if PRF is right for you or any of the other over 55 procedures that we do, find us online at RejuvenationMDMedSpa.com.